The Free State Provincial Health Department says it is concerned about the rising number of COVID-19 infections, as we've indicated in that story just above, where in Heidedal, which has been identified as the province's new hotspot after a number of people who have attended a funeral contracted the virus. We now cross over to our reporter, Palesa Moeti, who is joining us in Heidedal. Palesa, if you can hear us, what is it that the province is saying this afternoon?
To talk to us is one of the people that is here at one of the sites set up by the Department of Health to come and do screening and testing. That is Ntate Wayne Rotman. Ntate Rotman, thank you very much for coming to talk to us. You've decided to come and get yourself tested today. Why?
As you said, Heidedal is a hotspot. But the other problem is that they also say that even if you don't show any signs, you can still have COVID-19. That's why I came here, so I can test myself and be sure that I haven't got COVID-19.
What is the reason, do you think, that there's an increase in the number of infections? What are you seeing in the community?
People don't wear their masks, the social distancing, they don't adhere to it, and that is the biggest problem. You can see people that go after school, for instance, the children, they work in groups without masks, or the masks are hanging there, their chins and something. They are attending group sessions without any distancing between them or wearing masks, and that's the problem.
For us, it is important that we know that an area has COVID and we must stop any possible spread. It's not about being negative against or negatively labeling anybody. You've got Naledi. In Naledi, you've got Diversdorp, Wepener, and Van Stadenstraat. In all those areas, you've got in the schools, people are infected, and people go on and infect each other if they are not using the necessary protection and they are not following health advices. Then you've got, I think it's Lisimeng and Kopano, those areas as well. They have higher numbers, which we are attending to. So we are here and we will be doing this in all the areas that are hotspots, because the intention is to make sure that people adhere. And we're going into into the shopping malls, complexes in the community here to encourage people to come here, to come and screen and test, because many people are asymptomatic. They are infected somehow. They do not know that they are infected, and as they go around, they go on infecting other people unknowingly. So it's a source of concern. So in the best interest of the health of our own people.
So if you can just come closer to us, I see you're quite concerned, quite emotional about, how things are happening here. Just talk to us about that.
Yes, ma'am. We have a serious problem here. That lady with the yellow said they are going to test everyone here. So we are standing here to be tested. So we have a certain problem. So we'll pronounce it now and tell everyone they are not going to test us. That's the problem we have here.
Okay, so you would have preferred to be tested and not just be screened, right?
Everyone wants to be tested here because Heidedal is the hotspot. We just want to make sure that everyone will be tested. That's the problem.
Thank you very much. So that just goes to show the degree of concern that people actually have. The normal procedure, obviously, that we know from the Department of Health is that there's a screening process, and depending on what the findings are during that screening process, then people would get tested. But at this point, as you've heard, people actually just want to be tested. They just want to know what is the state of health. Quite a big concern that you're seeing here amongst the people that have actually managed to turn up today. The weather also is not very ideal. We don't know how many people will be actually able to come out today. But yeah, we're monitoring the situation. With that, it's back to you in studio.